Hello everyone, I'm Dr. Namrata Dalal. I'm an endodontist and an implantologist, and I have made this video to share a little knowledge on how to do dental triaging during this pandemic. So, unless you've been living under a rock like Patrick, I'm sure you're aware of how this tiny virus has turned the world upside down. A lot of us are scared, anxious, confused as to what to do during this time. But now is the best time to update our knowledge and not just blindly follow trends and precedents. So, the virus is called Severe Acute Respiratory Syndrome Coronavirus 2, and the disease this virus causes is called the Coronavirus Disease 2019 or COVID 19. So, why is this disease so important for us dentists? Get this, dentistry is the highest risk profession to the virus, next only to paramedics. This can majorly be attributed to our aerosol producing procedures and generally our nature of work entailing dealing with bodily fluids, saliva, blood, etc. etc. So, what is the future of dentistry now? Are we finally seeing the days when the dentist is more scared of the patient as opposed to the patient being scared of the dentist? Let's learn a little about this virus. So, this is basically a zoonotic virus with its origin being traced to bats and pangolins. It is more likely that dentists and especially endodontists will encounter patients with the virus. Why? Because we see emergency patients with pain. So, we must focus on preventing the nosocomial spread of this infection. So, let's look at the symptoms of the patient with COVID 19. The patient is going to present with fever, dry cough, body ache, nausea, and diarrhea. And one of the distinguishing features is the patient presents with dry cough and not wet cough. There's also a reduced sense of smell and an abnormal taste sensation, which is being linked to this infection. And on the chest x rays and CT findings, you can see typically ground glass opacities. This virus also has a predilection for men with a mean range of 56 years with immunosuppressive and underlying disorders as opposed to women. So there are three basic routes of transmission for this. Either there is a droplet or aerosol transmission. The second is surface contact. So when the virus lands on a surface and you touch it and you touch your face, your mouth, your eyes, and you get infected. And the third is fecal-oral route. The virus binds with the angiotensin converting enzyme 2 receptors, which are majorly present in our salivary glands. So there is abundance of the virus in our saliva, and the major route of spread of this virus is through aerosol or droplets because of the same reason. So telescreening and triaging is being recommended not only for dentistry but for other profession, medical, and other professions in general as well. So there are three questions that you need to ask your patient before you see the patient, and preferably 1 or 2 days before the appointment. Firstly, ask for the symptoms. We've gone through the symptoms. Ask if the patient has any of the symptoms. Ask if the patient has had a recent travel history to the banned countries or countries with high coronavirus cases. The patient has had recent contact or exposure to a known case. The incubation period of this virus is from 0 to 24 days. You have simple triage, advanced triage. Reverse triage is usually used when you want to discharge a lot of patients together. You have teletriaging, and teletriaging is what is basically applicable in dentistry right now. So, the first thing that you need to consider when you go back to your practice or if you want to open your practice again is how to do teletriaging for dental emergency patients. So, teletriaging. We need to know about the guidelines about treating asymptomatic COVID 19 patients. So, there are a lot of guidelines which have been released by the American Dental Associations, which clearly states that you should not be performing any dental procedures for symptomatic or active COVID 19 cases. So, if you have a confirmed COVID 19 case, it's better to redirect them to the nearest emergency COVID 19 facilities rather than seeing them in your clinic. So, start with telephonic consultations and do not allow any walk in patients. So, there are three algorithms which have been defined by the American Dental Association. Let's go through these. Algorithm 1 is interim guidance for triaging patients for emergency and urgent dental care. 2 is interim guidance for screening to identify COVID-19 infection for emergency and urgent dental patients. And 3 is interim guidance to minimize risk of COVID-19 transmission for emergency and urgent dental patients and healthcare professionals. So this algorithm basically tells us what questions do you need to ask for triaging patients for emergency and urgent dental care. Start with the basic question, are you experiencing dental pain? If the patient happens to say yes, the first question you ask is, have you experienced dental trauma? The patient may say yes or no. Now, if the patient says that he is not experiencing dental pain, what can be the next question? Are you experiencing any uncontrolled bleeding? If the patient is in fact experiencing uncontrolled bleeding, this is an emergency situation and you need to move to algorithm 2 to screen the patient for COVID-19 infection. If the patient is not having any uncontrolled bleeding, then it might be any of the following. The patient might need a suture removal, denture repair or adjustment prior to medical treatment or due to trouble eating. Dental treatment required prior to medical treatment, that is radiotherapy, any kind of biopsy of abnormal tissues, final crown bridge cementation, and so and so. When the patient needs these routine procedures, you can see if the patient is in an urgency. If you feel the patient is actually in an urgency, forward it to algorithm 2 for screening of COVID-19. If you feel the patient is not in an urgent situation, this can be delayed, reschedule the appointment. So we go back again to the previous question. If the patient does in fact have pain and you ask the patient if they have experienced any dental trauma and they say yes, so you need to identify if the trauma is involving facial bones potentially obstructing airways. If so, immediately refer to the patient to the emergency department. If no, and the patient only has dental trauma, the pain could be related to a lot of these reasons. These have been identified and listed by ADA. These could be pericoronitis, abscess, tooth fracture because of trauma, and the patient might need final crown bridge cementation if the temporary is lost. And so these patients again need to be sent for algorithm 2, that is screening to identify COVID-19 infection for emergency patients. If in fact the patient does not have dental trauma, then you need to ask the patient if the patient has fever and swelling on your face or inside the mouth. Okay, so now the patient says, yes, I have fever and swelling on my face or inside my mouth. Again, send the patient for screening to identify COVID-19 infection for emergency and urgent dental patients using algorithm 2. If the patient does not have fever and swelling, then what is the pain level for the patient? Try and rate it out between a level of 1 to 5, which is mild to moderate, or 6 to 10, which is severe or intolerable. If the pain and discomfort can be managed for 2-3 weeks, try and tell the patient to manage it at home and delay the scheduling of the appointment. If no, and if the pain is severe, again, algorithm 2, screening to identify COVID-19 infection for emergency and urgent dental patients. So now this is algorithm 2, where you need to screen the patient for COVID-19 infection for emergency and urgent dental patients. So this also is majorly on how you question the patients and what questions need to be asked to the patient. So the first question you will ask the patient is if the patient has fever. Now, if the patient says yes, the patient has fever, you do not have to immediately assume the patient is infected with COVID-19. The fever can be because of any number of dental reasons like an acute dental abscess or because of any other reasons related to dentistry also. So the next question which will follow is the patient has any signs of an acute respiratory infection or the patient is in respiratory distress. If the patient is in fact in respiratory distress and the patient does not have fever and the patient is still having respiratory problems, you should advise the patient to visit the emergency department or preferably consult the dentist available over there and immediately page the infection control. If the patient does not have any fever or any signs or symptoms of acute respiratory infection, we are going to move on to algorithm 3 to look. We are going to move on to algorithm 3, which is emergency or urgent dental patients who can be seen in the dental setting and basically how to deal with the risk of COVID-19 transmission in such patients with the viewpoint of minimizing the risk for the dental patients and their healthcare professionals. So if the patient has fever, but the patient does not have any signs and symptoms of acute respiratory distress, we can think that the fever is because of an underlying dental disorder or dental emergency, and we again move on to algorithm 3. Now, algorithm 3 is interim guidance to minimize risk of COVID-19 transmission for emergency and urgent dental patients and healthcare professionals. So this is basically when you actually need to see the patient in the dental setting, what are the steps and how do you go about it? The first question is this patient scheduled for an emergency in-person appointment? No. Is this patient scheduled for an urgent inpatient appointment? Was this patient scheduled as part of a routine non-urgent in-person appointment? Yes. So postpone the patient until further notice. So we need to understand emergency is something that we diagnose the patient as an emergency, and urgency is something the patient feels is urgent. For example, if I've lost a front tooth crown, it might be an urgency for me, but it's not a dental emergency in true situations and in this particular scenario. So if the patient is actually scheduled for an emergency in-person appointment, then does the diagnosis necessitate an aerosol generating procedure, for example, probably opening a root canal for the patient? Can this appointment be postponed without causing the patient significant pain and distress? No. If no, then we are going to go ahead with the treatment. If yes, then we're going to postpone it further. So this is a beautiful flow chart which has basically divided the procedures into aerosol generating and non-aerosol generating procedures for the patient, and what kind of personal protective equipment you have and you have used. So based on that, the kind of procedure and the kind of personal protective equipment you have used, you are going to categorize the risk for transmission to your healthcare professionals and the patient as low risk, moderate risk, and moderately high risk. So when there is low risk of transmission of the virus, you go ahead and you treat the patient. If there is moderate risk and moderately high risk, you refer the patient to emergency department or dental facilities that meet the criteria for scenario A. If not feasible, you treat the patient. A few important points which I found on the ADA guideline sites and nowhere else is that patients with resolved COVID-19 infections can actually be seen in dental settings. You need to give a gap of at least 3 days, which is 72 hours, since the COVID-19 infection symptoms have resolved, and at least 7 days since the symptoms first appeared. There are additional measures that the site recommends, for example, using of a dental handpiece with anti-retraction function, the four-handed dentistry or the four-handed technique to treat the patient, high volume saliva ejectors, and a rubber dam. A rubber dam is crucial at this time. Do not practice any dentistry without rubber dam isolation. This is going to decrease the risk of exposure to the infectious agents for us and the patient as well. And the handpieces, needless to say, has to be sterilized after removal of all debris, proper heat sterilization. So you can have the patient rinse with 1.5% hydrogen peroxide or 0.2% povidone before each appointment. That greatly reduces the bacterial load in the mouth. For pediatric patients who cannot rinse on their own, please use a rubber dam, and before using a rubber dam, use cotton rolls to soak the saliva all around the area. It may not be easy for the patient to rinse appropriately at this time. So the Indian guidelines have been released. This is a unified guideline released by Ministry of Health and Family Welfare in India. So the zones and dental clinics which are there in the containment zones currently cannot be opened, and you cannot begin to see patients in these zones. In the red zone, emergency dental procedures can be performed. Dental clinics in the green and the orange zone will function to provide dental consults, and dental operations should be restricted to emergency and urgent treatment procedures only. So the guidelines say that all routine and elective dental procedures should be deferred for a later review until new policy and guidelines are issued. Due to the high risk associated with examination of the oral cavity, the National Cancer Screening Program has been deferred until new policy guidelines are issued. On the side, you can see that various procedures have been categorized into very high risk, moderate risk, and so forth and so on for dental procedures to be able to triage patients more conveniently. Emergency dental procedures, which basically entail uncontrolled dental pain, uncontrolled bleeding of dental origin, Ludwig's angina, acute cellulitis of dental origin, acute trismus. So these have been categorized into risk levels. So it's understood that proper precautions, PP, needs to be followed in these situations, but what exactly needs to be followed is not very clear according to the Indian guidelines as of now. So you can see the urgent procedures have been divided into two categories for children and adolescents and adults and geriatrics. Patients with medical conditions are high and very high risk, of course. Some of the additional points the guidelines say is the use of dental handpiece with anti-retraction function, four-handed dental technique, high volume saliva ejectors, rinsing with 1.5% hydrogen peroxide and 0.2% povidone before each appointment, and dental patients that have been referred to other settings due to suspected COVID-19 infection be maintained. So there is a list of patients which have been referred to other settings because they have been suspected of COVID-19. So you should maintain that list in the clinic at all times. I found this site extremely helpful. They have very detailed guidelines on what to do during this pandemic for a dentist. And the dilemma I was in has been decreased to quite an extent and it has been cleared. And I know we don't want to go back after this lockdown, but there will be a day when we go back to our practice, we open the shutters, and the least that we can do is be prepared, have full knowledge for our sake and for the safety of our patients. Sayonara. Bye.